Okay, welcome to this podcast for Chapter 12. We're talking about home care here. This won't be a particularly long podcast. We have 14 pages in the textbook to read. In this particular podcast, there are 17 slides. We will also have coverage of 6 IRATs during this podcast. So hopefully you have your outline, you can take notes. Bear in mind before we even get started that there are 5 objectives that we'll be addressing as we go through the podcast. There are really no significant figures or tables to look at. Team 3, by the way, has been assigned to develop a videotape case presentation for the case scenario at the beginning of this chapter. It involves a 70-year-old female named Mary. She has osteomyelitis of the left foot, and she's been referred to a home care service for IV antibiotic therapy. So the health maintenance organization is expecting the team members, those on team 3, to come up with some answers on how to handle this situation. Moving on, the slide, just an overview of home care industries. You can see a list there. Home health services, nursing services, hospice services, speech and physical therapy, social services, homemaker services, and home infusion therapy. So as we go through these slides, and again, we have 17 of them, we'll be talking about all these kinds of services. Now, I want you to know for one of the IRATs, that in addition to nursing and pharmacy services, home care services may include, again, looking at the top here, things like physical therapy, social services, homemaker services. Okay, and moving on to the next slide. Home infusion therapy, you may not be aware of it, but there are pharmacists, that's all they do. They have like a small company. They have a building where they put together a home infusion therapy and then deliver it to people's homes. It's for nutrition, like total parenteral nutrition, Hyper-Al, very large bags that may be 2 to 3 liters, and they hang them maybe even for a 24-hour period. Anti-infective therapy, like Team 3 has a case about that. Pain management, morphine drips and so on. Intrathecal morphine, where you just have to be very careful about the sterility of the product, and that's actually injected right into the meninges. Chemotherapy, biologicals and related plasma-derived therapies, they may even be for cancer patients, and miscellaneous therapies. So from this particular slide will come another IRAT, and you need to know what is considered a biological home infused therapy, which is that 5th bullet there, biologicals. A biological home infusion therapy, an example of that would be interferon. Now, you can get that from reading the chapter, but interferon may be something that you've not been acquainted with unless you've worked in a hospital pharmacy. But that's a biological home infusion therapy that's made available through this home infusion therapy companies. Home medical equipment involves durable medical equipment. Now, be advised, most pharmacies do not stock durable medical equipment. These are large items that are usually in some sort of a warehouse environment. Some mom and pop shops will carry some durable medical equipment, but it depending on state law, it usually requires a separate license. So you have to have a pharmacy license and a DME license. Examples of that are wheelchairs, bathroom safety supplies, hospital beds, ambulatory aids like canes and so on, walkers, and infusion pumps. There's also respiratory therapy and supplies like oxygen tanks, CPAPs, and other miscellaneous supplies. Now, again, on this particular slide, there will be an IRAT that comes from this particular slide. You need to know that a hospital bed would be considered durable medical equipment, DME. Factors that influence the home care industry are reimbursement issues, legal, regulatory, and professional standards, and advances in technology. So all of these factors influence how healthcare is delivered, how pharmacists, what they do, and how they do it. Reimbursement issues coming from this slide earlier. Reimbursement issues, first, there's insurance carriers that might be government, managed care organizations, or private sector. These third-party payers, like in the government or Medicare and Medicaid, so if you're talking about people over 65, Medicare, people that are around the poverty level or just below, they get money from the government for home care. Again, from this slide, there's an IRAT coming from the information on this slide. You need to know that one goal of managed care organizations when you're talking about home care, when you're talking about any kind of care, also in hospitals and community, it's to help control healthcare costs. That's the prime directive, so to speak, or the main goal of managed care organizations is to help control healthcare costs. There's legal, regulatory, and professional standards that are spelled out by the Balanced Budget Act of 1997, the Health Insurance Portability and Accountability Act of 1996, that you otherwise know as HIPAA, different regulatory agencies like the Joint Commission, the Accrediting Commission for Healthcare, and the Community Health Preventative and Service Organizations, CHAPS. There's different advances in technology that we talked about earlier on this slide that affect home care, such as infusion pumps. These have become much more easy to work. So, you know, they used to be very technical, but now they're becoming very user-friendly. They're ambulatory, lightweight, and inconspicuous. There's internet and wireless communications that allow for data sharing and access to health and drug information. So, for example, if a patient suffers from high blood pressure, they can just put their arm in a machine, looks like a blood pressure cuff, and the machine will pump up the blood pressure cuff, register the blood pressure, and send that data right to the primary care provider. So somebody doesn't have to go out and take the blood pressure at somebody's home. There's information technology systems have been developed slowly due to the small size of the industry, but it is picking up because of the baby boomers retiring. The role of the pharmacist is selection of patients for home care. They help the primary care physician to make that determination, developing a care plan involving the medications, selection of therapy. Again, it might be nutrition, it might be chemotherapy, and so on. And there's different compounding issues. So when you're talking about maybe a bedridden patient, there may be issues about how that is administered to the patient. Selection of the patient, it's a joint decision by the pharmacy and nursing in conjunction with the patient's primary care physician. There's insurance issues, in part the ability to pay as part of the assessment process. And there's different social factors. Supportive, the idea is to support the family members. There may be a caregiver from the family. Also, the physical condition of the home needs to be evaluated. You may have a person who has a difficulty with walking. Maybe they need a walker. Maybe they need something like a machine to help them get from the first floor to the second floor or the first floor down to the basement. Sometimes they need that help, especially like when they're doing laundry. From the slide, there's another IRAT you need to be aware of. That home hospice services are usually provided to terminally ill patients who require primarily comfort measures. Again, primarily comfort measures. When you're talking about hospice and terminally ill, you're not really talking about curing, you're talking about caring or comfort measures. Developing a care plan, you need clear objectives. They must be developed with the selection of the therapy in mind, the nature and frequency of the monitoring parameters, and desired outcomes. You need to address specific problems, identify them and their goals. You need to plan. Using or thinking through the patient's medical problems, just not the immediate problem. There's a selection of therapy. Basically, the safety and convenience factors should be considered. The first dose may be administered in a controlled setting if risk of allergic reaction, like with the case that Team 3 is going through. You're talking about the use of like an antibiotic that is related to penicillin. If the patient thinks or may think that the patient is allergic to penicillin because they had a stomach ache, but they aren't sure if they have a reaction to penicillin and the cephalosporins, you may want to wait around to see if they have an allergic reaction to that first mini bag of cefazolin. Once daily administered, more suitable for home care. If you're talking about something that has to be administered several times a day, that becomes more problematic. Also, drugs need to last more than a day. Some drugs, the minute you mix it up, you have to administer it. So those are all considerations when selecting therapy. There's compounding issues. There's drug solution stability. Well, we just talked about that. Extended expiration dating. Depends on the drug. Packaging, glass versus plastic. Some drugs have to be covered, like with aluminum foil. You'll get into that later in the curriculum. But a lot of drugs are light sensitive. There's infusion devices. Select appropriate device based on the drug and the patient's needs. So basically, like an infusion device for a a small mini bag would be different. Like mini bags are like 50 mLs, which is like a couple of ounces, whereas a TPN, total parental nutrition, otherwise known as Hyper-L, might be a 2 or 3 liters, like a couple of gallons. So you can see that the infusion devices are quite varied, and you have to think about which one to use. Delivery schedules, less frequent delivery is preferred. Again, it goes back to the stability of these drugs. Some, once you mix it, you have to administer it. So you have to keep in mind those stability issues. Now, there is an IRAT that comes from this particular slide, thinking about it. But when you're thinking about whether these products can be are a good selection for a patient at home, you really these parental products, the ones that are most suitable for administration in the home are products that are stable for longer than 24 hours. Okay, moving on, other responsibilities of the pharmacist: monitoring drug therapy, communication with the physicians, nurses, patients, and others, drug information, and home care standards that have been articulated by the American Society of Health System Pharmacy. So you may not know this yet, but the American Society of Health System Pharmacists used to be called the American Society of Hospital Pharmacists. They put a lot of standards in, they published them in the Journal for the American Society of Health System Pharmacists. So when you're looking for standards like for home care, hospital care, and so on, you'll find them published in the Journal of the American Society of Health System Pharmacists. Education and training. There's different colleges of pharmacy. Their curricula typically includes sterile product preparation and or parapharmaceuticals, so you learn how to put together total parental nutrition, Hyper-L, chemotherapy, these mini bags for antibiotics and such. There's courses or a course component that addresses home care, business management, and reimbursement issues. Again, next year when you take my course in pharmacy management, we'll cover these issues again in more detail. There's early and advanced practice experiences on home care. So those are part of the IPPEs and APPEs that you'll be taking. Residency programs, there's a limited number of these postgraduate training programs, but they are available usually through the American Society of Consultant Pharmacists, ASCP. In conclusion, home care encompasses provision of many products and services. There are factors such as reimbursement issues, regulatory requirements, and advances in technology that influence the home care industry. Pharmacists must remain competent to fulfill their role as home care providers. So again, when you finish pharmacy school, it's just a beginning. Things change, and right now they seem to be changing quite a bit. The role of the pharmacist in home care is expected to grow with advances in technology and the shifts to an older population. And that is this podcast for Chapter